And let me show you some of these pictures so you see why it works. And then I'll talk about how this translated into what Juvenesce is and why it works. I'm trying to get that. Okay, so here's someone who's lost volume in their face. A lot of times, in the old days, we used to think, oh, this is because she's got bags under her eyes. Well, everybody has bags under their eyes because that's the fat that supports your eyeball, okay? When we change our weight, when we lose weight, when we age, we lose this fat on our cheeks, and then that fat under the eyes protrude a lot more. The concepts are changing in cosmetic surgery. It's not just pulling and making things tighter, but filling and making it more volume, giving it the useful look. And when you do that, you transform this person into a much younger, healthier looking person. This is 12 days out. So she's not bruised, she's able to go out, she's able to do things that she would normally do. You were not able to do this with traditional surgery. She would need an eye surgery, she would need a cheek implant, a lot of things that we don't do anymore. So the stem cells are just starting to work. It's going to take about 3 months for those stem cells to incorporate into the tissues and to continue to give her improvement. Here's another patient, and she's got a lot of hollowness here. She's an avid runner. She's a marathon runner. She has lost a lot of the volume in her face because she's just very athletic. So when you put it back in 4 days later, she looks much more youthful. And if you look at her nose and you look at her lips, which I didn't actually touch, the proportions have changed, and she looks a lot more balanced. The proportions to her nose and cheeks makes her nose look smaller, but we didn't really touch it. Here's someone who had a facelift 10 years ago. They didn't like the way they looked. They were always on TV, but they were being told they look tired or they don't look as healthy or as young. And I put the stem cells here and here. And basically, again, I didn't touch her lips and I didn't touch her nose. And she's much more youthful and much better. And this is 2 years out. So she's gotten very good results. She looks very natural. You wouldn't see her in the street and say she has had plastic surgery. And one other thing we did for her that she had kids. And since her kids, she didn't enjoy things the way she did before. So we took those stem cells and we injected it actually into the vaginal canal. So she got a rejuvenation down there as well. Her comment was it should be mandatory for anybody after kids. Okay, this is what I have the passion. This is a patient who has skin cancer, and you just saw the video for him. He couldn't get anybody to fix him using traditional reconstructive surgery because there was no blood vessels here. All the radiation had killed off his blood vessels. Every time they would try to cut this, it would start to die off. They couldn't fill it because it would start to die off. The skin didn't have enough blood flow to it. What we did was bring in the stem cells from the corner, if I can get this, from here, and we put it in and filled it gradually, building in all that blood vessels. It took me 2 years to do this. But when you touch his jaw now, it's hard. When you touch up here, it's soft. I didn't do that. That's the stem cells. They know what to do. His skin was very damaged by the radiation. It looked terrible. His skin, you can't see it in the pictures very well, but his skin looks almost normal because of the stem cell treatments. That you could not get with any reconstructive surgery. You can use it on all skin colors. You don't have to worry about discoloration. You don't have to worry about any of the issues of keloids. Here's someone who didn't have a lot of jaw over here, and she wanted to get a jaw implant. And she came to me, and I said, we can do this without doing an implant. And we did it with the stem cells, and this is right after. And I've seen her back a few times, and she looks fantastic. I mean, it's her jaw. It will move the way and it will change with you over time. It will